Officials have said over and over again the virus doesn't discriminate. But the disparities that have long been part of our medical system in America are now leading to what some call a crisis within a crisis. Black and brown communities across the country being hit harder, in greater numbers, and with fewer resources to save them.
So currently I work out of an urgent care clinic in central Brooklyn where the population is largely Black and brown.
Dr. Blackstock, you had told me that before the pandemic even hit, you were worried that those same patients you serve in your community were going to be hit harder. Why is that?
For multiple reasons. I mean, even thinking about the testing criteria that was initially being used to determine whether or not someone had exposure to COVID-19, it included the person needed to have traveled abroad to one of the countries where COVID-19 was endemic, like Italy or China. Also required someone having to know someone who had tested positive. And what we knew very early on was that, there were communities that did not have access to testing. And these are communities that already carry very high chronic disease burdens like diabetes, high blood pressure, asthma. There are also high rates of obesity. And, these have all been tied into racial health disparities linked to structural racism. What we already know, as you alluded to, is that when Black and brown people interface with the healthcare system, they often encounter provider bias. So we know, and it's well documented, that their pain is undertreated or their complaints are minimized. So my concern is that when these patients present to emergency departments and hospitals in their areas with COVID-19 symptoms, that their symptoms may be downplayed or they may not be taken seriously. And we do already have the data to support that trend continuing to happen. I'm scared. I'm scared that these communities are going to be absolutely ravaged and devastated by COVID-19.